This conference will now be recorded.
So welcome everyone here today. Hello, hello. Thank you for being here for Paradigm Medical's presentation on advances in breast cancer research, screening, and treatment. At Paradigm, we are committed to continued education and supporting healthcare practitioners and fitters. You are on the front lines of working with women and addressing their health concerns. So we want to support you so you can support them. Today, we will discuss recent advances in breast cancer research and what this means to you and your clients. My name is Jennifer Wang, the president of Paradigm Medical. As a national medical products distributor, we specialize in post-mastectomy, lymphedema, and orthopedic footwear and foot care products. It is our mission to provide great medical products to underserviced markets in Canada. We believe that all people should have access. Most notably, you'll know us as the exclusive Canadian distributor of American Breast Care products, a line of post-mastectomy garments and breast prostheses, biocompression systems, a line of pneumatic compression pumps for the treatment of lymphedema and venous insufficiency, Podewell, Padors, Oasis, iRunner, and Go Seamless footwear and foot care products. This year, we're celebrating our 30th anniversary. Very exciting and a huge accomplishment, 30 years. So we're very excited to have you all here today. Today, presenting will be France Foster. She's our education specialist and breast care fitter with over 25 years of experience. Understanding the importance of education, France and I have spent over 25 hours preparing for this webinar. So I'm very happy to see you here today, all of you, investing in yourself and participating in today's discussion. Bravo. Just a couple little GoToWebinar tips. Please mute your devices. It looks like everyone is muted. That's wonderful, just to minimize any distractions or background noises. And then as well, if you have any questions, feel free to use, there's a little chat function. It's in the shape of a dialog box. You can use that to type any of your questions, or feel free to unmute yourself and speak your questions. We've got a lively discussion today, so we look forward to hearing all of your feedback and your thoughts. With that, I will pass it to France.
Thank you so very much, Jennifer, and welcome everyone. Looking forward to presenting this today. So the schedule, as you can see on the screen, will talk about different statistics, research, screening methods. We're going to touch on the Preventive Health Care Task Force, screening updates, advances in treatments, and how those trends impact your business. And we're going to open up the floor for a Q&A session, absolutely. All right, so let's get started. So the first thing I want to bring up is that the Canadian Cancer Society does bring out a statistical report every year. And it's a publication that provides comprehensive, up-to-date estimates of the impact of cancer in Canada. It is the only source of national estimates of cancer incidence and mortality projected to the current year. I haven't seen a 2024 report yet. The goal of providing these projections is to estimate underlying impact of cancer, especially impact on healthcare resources. So if we look at the stats in 2023, 239,100 people in Canada were expected to hear the words, "You have cancer," compared to 233,900 in 2022, which is a 2.2% increase over prior year. So this is, the incidences of cancer in Canada keeps increasing. Additionally, 86,700 will die from the disease. And obviously, cancer remains by far the leading cause of death in Canada. Next, let's take a look at how it impacts males versus females. Prostate cancer remains the most commonly diagnosed cancer in males, while breast cancer currently remains the most commonly diagnosed cancer in females. When we combine lung and bronchus and breast and prostate and colorectal cancers, they actually account for almost half of all the new cancer cases diagnosed, which is a huge, huge impact. Next, we're going to talk about some Canadian statistics related to breast cancer specifically. So this is something that we look at every year. For women, it's always a very high number. We have an estimate of 29,400 versus 5,400 that would die from that disease. The 5-year net survival rate is 89%, which is still a very good rate. For men, the impact is more significant in terms of the 5-year survival rate because they don't often get diagnosed quickly enough, so their survival rate is around 76%. It is estimated that about 1 in 8 Canadian women will develop breast cancer during their lifetime, and 1 in 36 will die from it. Now, as far as the number of breast cancer cases in terms of percentage, 26% is the percentage of all estimated new cancer cases in women in 2023, and that's only breast cancer cases, which is a big number. And on the next slide is the percentage of all estimated cancer deaths for women, which is 13%. So it's breast cancer deaths account for 13% of all cancer deaths in Canada. Also interesting facts is that breast cancer by age, as you can see from this slide here, is that women under 30 have a probability of getting breast cancer only 0.5%. When a woman reaches 30, so the bracket of 30 to 49, it's 16.3%. 50 to 69, it's 48.7%. And 70 plus is 33.4%. So it's a disease that starts becoming important as women reach the age 40. The 5-year survival rate for women touched by breast cancer is lower for women who are in the 15 to 44 age range, so 88%, which is kind of the national average. You see that between the ages of 45 and 74, the 5-year survival rate is 90 to 91%, and then it starts diminishing after age 75. We've seen a slight change in breast cancer survival in Canada. It remains steadily around 87% since 2011, but the most recent stats from the Canadian Cancer Society show that it's around 88%. With that said, the 5-year survival rate for young women with breast cancer is among the lowest in all the groups, so their survival rate is one of the lowest. What's even more alarming is that the death rate, the mortality rate for that age bracket 30 to 49 is 16%, which is more than double the average for the other 3 age categories. So breast cancer is one of the leading causes of cancer deaths for those under 50. So there are also many possible reasons for this. It could be delayed diagnosis, later stage diagnosis, and the fact that breast cancers in young women are known to be more aggressive. So how does this impact the future of young women in Canada? It means that we still need to address treatment and care issues for young women in Canada, including delays in diagnosis, cancers that are more advanced at diagnosis, higher mortality rates, low participation in clinical trials, lack of age-appropriate care, concerns around social support during cancer treatment, late effects of treatment, higher recurrence rates, and longer-term psychosocial concerns and factors. So we have noted some different trends in Canada in terms of when it comes to women and breast cancer, is that more younger women seem to be diagnosed with cancer, and we'll show you some stats later that show that. So it could very well be that in your business you could see a greater need for breast prosthesis that offer a more average to full profile, and also a higher demand for seamless cut bras because younger women are looking for to remain trendy. There are also more breast conserving surgeries, such as lumpectomies and partial mastectomies, that are being performed. So again, you could potentially see a greater need for breast conserving prosthesis, such as partials and shapers. Another trend is that you may also see more uneven chest walls because often surgeons leave flaps that are intended for reconstruction on the chest wall. So that can make it more difficult to fit. So you may require a prosthesis that has more of a moldable back or for a custom prosthesis. So on the next slide, we show you what the ABC custom breast prosthesis looks like. And Jennifer will take a moment here just to explain this a little bit.
Yeah, so this is some exciting news. We have done sort of a soft launch in Canada. Will be where we've introduced the custom breast prosthesis here. There'll be more details and info to follow. We'll likely have a separate webinar to talk about this in detail and introduce it to all of the fitters and explain how it works and the technology and the process. But just for this presentation, we just wanted to kind of mention it and introduce it, but more details will come soon. Thank you, Franz.
Thank you, Jennifer. So you may also see trends, more trends would be more reconstructions happening. Obviously, it's being offered to all the, most women now, unless they have medical issues that prevent them from getting that. So you could see a need for more partials and shapers. And also reconstructions aren't necessarily even, they may be even at the beginning, but they may become uneven with time as the natural breast matures and continues aging, which causes different shapes and sizes caused by age and also by weight gain or loss. So again, it's something that you have to think about, and you may see more need for this type of product. There are also more women who decide to go flat, so they would have a double mastectomy, and that could be because they were diagnosed younger, which increases their chance of recurrence. So they may just decide, or maybe they have the BRCA gene or one of those genes that make them more susceptible to breast cancer. So they decide to do a double mastectomy and just reduce that risk as much as they can. Those women may or may not opt to wear breast forms. I've met women who decide not to wear any. And but when they have that surgery, they would require a product such as the compression bra, which is the 519F for flat. So it's a product that's very, very helpful in keeping compression across the chest area. It reduces swelling, and it has a bunch of other benefits. It also reduces the risk of infection and things like that. One other trend that we've discovered is that with the collected data from manufacturing the custom breast prosthesis, we noticed that we're making more wider breast forms, as it seems like a lot of women are more wide-chested. So this could be due to an obesity factor. So you may see a greater need to provide breast prosthesis that offer a wider footprint. So we're going to open up the floor here and ask you, what other trends are you seeing? So we encourage you to speak up or put some comments in the chat box or unmute yourself. But ABC product developments are based on trends, but also your feedback. So we want to hear from you.
Yeah, these are just a few of the ones that we've highlighted based on what we're seeing through our data, whether it be through the custom breast prosthesis program that we've been running in the US for many years. But I think it's very important to speak with, fitters who are actually at the front line fitting on a day-to-day basis. So if there is any feedback that you have or trends that you're seeing on your end, we would love to hear that. And we will pass that information back to the product development team so that we can ensure that women are getting the products that they need today based on their current needs. And we do understand there's so many changes that take place in the whether it be healthcare treatment, treatment options, and things of that sort, which could impact the products that are necessary. So we will just leave that with you for now to kind of let it simmer, and please do pass along your feedback. But for the sake of time, we can just keep moving forward, Franz.
Absolutely. All right. So next is going to be we're going to talk about some research. So I went through the internet. I picked a few research programs that are going on at the moment that are very interesting. Of course, I can't skim the whole internet and present everything, so I picked a few. And one interesting study that is happening currently is by Breast Cancer Canada, and it's called Progress. So as in patient-reported outcomes, PRO. So this initiative collects patient-reported outcomes data through questionnaires from diverse experiences of breast cancer participants from diagnosis, treatment, and surveillance. So people that are diagnosed with breast cancer at any stage during any period of their journey will complete questionnaires 4 times a year to share their individual experience and outcomes of breast cancer across Canada. So this is going to go on for 10 years. The data will be collected into a database for researchers and clinicians to analyze large population responses and learn more about breast cancer issues and improvements from the patient perspective. I think this is definitely a first in terms of research to look at it from the patient's perspective. I think it's wonderful. So you can learn more about that. It's called progresstracker.ca. And the next slide, we have a quick video that explains this a little bit. So it's very short, but interesting video.
One breast cancer story is powerful, but imagine the impact of thousands coming together in one place. Breast Cancer Canada is proud to launch Progress Tracker. The Progress Tracker Breast Cancer Registry aims to uncover the breast cancer experience directly from the best source, the patient. I was the first patient in Canada to register. I was easily able to enter the details from my pathology report, which brought me to my first custom questionnaire, made for me. I am proud to participate in Canadian breast cancer research taking place from coast to coast. My voice will impact the future of breast cancer care. Anyone with a breast cancer diagnosis can register at any stage, any time, by visiting progresstracker.ca.
Make sure to check that out. I think it's a very, very interesting research that is happening at the moment. Okay, on the next slide, just let Jennifer catch up with me here. We're going to talk about patient-focused precision oncology. So I believe that some of us, unless we've been affected by breast cancer, don't realize that breast cancer isn't just one disease. There's so many different types. There's over 50 different types of breast cancers, each needing specific treatments. And that's what precision oncology is it's personalized treatments that match the right plan with the right person at the right time. And honestly, this has come a tremendous long way over the last 10 to 20 years. So it's a very worthwhile. You can read more about that at breastcancerprogress.ca. Another very interesting research. Now, this is a US-based, but it was so interesting that I had to bring it up here. So this is called a new approach to robotic mastectomy that can preserve full breast and nipple sensation. So typically, modern mastectomies and breast reconstruction result in losing full sensation in the nipple and the breast due to nerve damage from stretching and cutting the breast tissue. But these two scientists from the Utah Southwest Medical Center have developed a first-of-its-kind robotic nipple-sparing mastectomy and a reconstruction procedure that provides remarkably natural-looking outcomes while preserving full breast sensation. The full breast sensation part of this is what's surprising, is because they did not expect it. They didn't think that that wasn't their goal. Their goal was to use doing robotic mastectomy. So what they did, rather than making incisions in the underwire area below the breast, as it's typically done, they used a single port robot to enter the breast from the armpit to remove tissue and reconstruct the breast, avoiding the nerve damage that results in desensitization. They published a 4-year study in JAMA Surgery Journal showing that single port robotic nipple sparing mastectomy is not only a safe and feasible approach to breast reconstruction, it also gives patients a very good chance of retaining some or all of the sensitivity in their breast. So it was a surprising and unintended result. But so we don't know if this is going to become available in Canada. It's still in the early stages. This was just published in February 2024, but hopefully in time it will be available here. Okay, next is creating a better tool to find breast cancer cells. So this is a research funded by the Canadian Cancer Society, where Dr. Addison will develop and test a new dye to find breast cancer cells based on fructose. So they will inject dyes into the body that are currently used to help scanners detect breast cancer cells, which don't find up to 50% of breast cancer. So that means that some cancers are missed. But fructose is a sugar found in fruits and vegetables, and recent research has shown that fructose can be used by breast cancer cells as an energy source. So the researchers plan to test a new dye on patients in a clinical trial within the next few years, and if it's successful, this new dye will improve the reliability and accuracy of breast cancer detection. Right. Next is advancing precision therapies by investigating resistance in tumors. So a team led by Dr. April Rose, again, this is a Canadian research program happening at the moment, is working to understand why some people do not respond to certain precision therapies and how tumors can become more resistant to treatment over time. So it's a research based on a gene called BRAF, which is at the center of the study, as it is one of the most commonly altered pieces of DNA in cancer. And if successful, this research could provide new ways of treating tumors and improving patient outcomes. There is also another research going on, and it's trying to develop a new vaccine to treat triple-negative breast cancer. So triple-negative breast cancer is where the estrogen receptor is negative, the progesterone receptor is negative, and it's also HER2 negative. This is a cancer that accounts for about 10 to 15% of cases. So Dr. Tai, with the support of her team, is developing a treatment that uses a person's own tumor cells in combination with a cancer-killing virus to create an immunotherapy vaccine that will target triple-negative breast cancer. So this research is ongoing. So hopefully this is successful. All right, so let's quickly talk about the different types of screening methods that are available. Of course, we all know about breast self-exam, clinical breast exam performed by a health practitioner, mammography, which can be 2D or 3D, so I'll talk about 3D on a separate slide, ultrasound, which can be handheld or automated. There's also MRI and abbreviated MRI. So an abbreviated MRI is a shorter version of the standard breast MRI, which takes fewer images and takes less time to read. Contrast enhanced mammography, where a standard iodinated contrast agent is used, which is the same contrast used for CT scans. And cancer cells take up the contrast agent, which absorbs X-rays, so the cancer appears white on a mammogram. And then there's also molecular breast imaging, where a small amount of radioactive material is injected and accumulates in cancer cells. And then they use a gamma camera to detect the tracer. This technique is actually, so MBI at a low dose is being tested in a trial in Toronto. Let's go back to 3D mammography or tomosynthesis. The question is tomosynthesis more effective for dense breast? I can say yes, it is, up to category C. So Jennifer will switch over to a Facebook page here where I found this video from Dr. Paula Gordon from Dense Breast Canada. And she'll play that for you.
My name's Dr. Paula Gordon. Hello, my name's Dr. Paula Gordon, and I'm a breast radiologist in Vancouver, responding to some of the questions and comments that were left on the Dense Breast Canada survey. The first is about tomosynthesis, and this person asks, I would like to know where 3D tomosynthesis fits into surveillance and screening protocols following breast cancer. Well, tomosynthesis is not widely available across Canada, and it's not officially incorporated into any of the screening programs, but is available for diagnostic. So it would depend where you attend for your surveillance mammography and whether they have tomosynthesis and whether they use it routinely. Ideally, it should be used because it does find more cancers than regular 2D mammograms. And at the same time, it reduces the number of false alarms that we see commonly with mammography. So if you can get it, it's advisable that you do. You should know, though, that for women in category D, the highest breast density category, the tomosynthesis is not as effective as it is in the lower categories. In fact, it's actually most effective in categories B and C. That's because in category A, we find almost all the cancers with 2D mammography. And in category D, those same cancers are masked in dense tissue for the same reason that they're masked on 2D. So if you can get tomosynthesis for your surveillance mammography after breast cancer, please do.
Perfect. She explains it a lot better than I do. So tomosynthesis or 3D mammogram is available in a few provinces as a screening tool, but for now is mostly used as a diagnostic tool, as she said. It increases the detection of invasive cancer by an additional 1 to 2 cancers per 1,000 women. The advantages are that a biopsy can be performed right away. It means fewer visits to the hospital and less anxiety for the woman. So talk to your clients, let them know that this exists, and and they can find out if this is available in their area. It's not fully available everywhere, but it's a good thing to ask the question. Now, AI seems to be invading our whole world. So artificial intelligence assisted screening. The CBC News article from September 23 said that AI shows major promise in breast cancer detection. It reduces the radiologist's workload, and we know that there are actually a worldwide radiologist shortage, so this would tremendously help in the screening process. AI can overdiagnose and can have trouble with dense breast also. Race and ethnicity was not recorded in some of the studies that were presented, so data may be skewed. Excuse me. And Black and Asian women can also have more dense breasts, so we don't know if these women were included in the studies that were done. So more research is needed to determine true success rate. And on the next slide, Health Canada actually approved the use of AI mammograms, which could detect breast cancers years in advance. This technology is currently in the US. It's called Profound Risk. It uses AI to provide women with personalized risk estimations 1 to 2 years ahead of time, even when a current mammogram comes back clear, and was found to be more accurate than current risk assessment devices in use. So it's been approved by Health Canada as of last summer 2023. So it could mean that it will likely become accessible to Canadians in a few years. We don't know exactly when. Preventive health care. So let's talk about that a little bit. So there's a Canadian task force. It's called the Canadian Task Force on Healthcare, and they so every few years they re-examine the breast cancer screening guidelines. So right at the moment they are examining. They should be examining new multiple types of evidence to update their 2018 breast cancer screening guidelines, which additional funding was provided by the Minister of Health. It was supposed to come out in 2025, but it's supposed to be released in May 2024. But what's puzzling about the Canadian Task Force, on the next slide, is that if you actually go on their website, so if you Google Canadian Task Force on breast cancer, the task force actually recommended that women should not even do breast self-exam or get a clinical breast exam to screen breast cancer, and that for women aged 40 to 49, they did not recommend any screening for mammography with a mammography. So it's very puzzling to see and hear that. It's also very alarming. So if we go to the next slide, this is despite the facts that, so these are some of the facts that are actually collected, that women 40 to 59 years old who lived in the Canadian provinces or territories whose screening programs did not include women in their 40s had significantly higher proportions of breast cancer diagnosed at stages 2 and 3 and 4 for women in their 40s. Additional research showed breast cancer mortality rates to be significantly higher in the women living in the same jurisdictions with reduced 10-year net survival. So trends in Canada show significant increasing incidence of breast cancer in women in their 40s by 8% for 20 years, which is 0.39% annualized percent change, and even steeper increase since 2015, or 1.6% annualized percent change. So the Canadian Task Force has not been using more recent data to give those guidelines. Furthermore, the Nurse Practitioner Association of Canada just withdrew in March 2024 their endorsement of the 2018 breast cancer screening guidelines suggested by the CTF. They joined the Canadian Cancer Society, who did the same in 2022. These organizations are not just highlighting flaws in the guidelines, but also championing the cause of science in women's health. So we need to be aware of these things. And on the next slide, we talk about what the ACR, which is the American College of Radiology, and the SBI, the Society of Breast Imaging, are actually recommending. So by weighing the benefits and risks of mammography, and it should be done by women, not for women. So their recommendations are that all women should have a risk assessment done by age 30, annual mammography screening starting at age 40. Screening should continue past age 74, eliminating the upper age limit. And benefits should be considered along with the possibility of recall for additional imaging, benign biopsy, risk of anxiety, and overdiagnosis. So just, it's just information that you need to know, because there's a lot of disparity between what the screening guidelines are from the Canadian task force versus what experts are actually saying. So next is updated provincial screening updates. So thankfully, our provincial governments are doing things differently. Dense Breast Canada has been advocating for this for 8 years or more. And so let's talk about dense breasts a little bit. So dense breasts are normal, they're common. It refers to the composition of tissues in the breast. Dense breasts contain a higher proportion of glandular and fibrous tissue compared to fat. So breasts that have more than 50% glandular and fibrous tissue are called dense breasts. So categories C and D are regarded as dense. But it is thanks to Dense Breast Canada that these changes have been accomplished, and we'll go through some of those changes. So on the next slide is what a breast looks like at different stages and within different breast density. So A is a very not a dense breast at all. So you can easily detect a cancer. In B, we see a scattered area of density. So it could make it a little bit more difficult to detect breast cancer there. But C and D are very dense breasts. So that's when it makes reading a mammogram really, really difficult. So cancers can be missed. So over the last, as I said, between 2016 and now, when this movement started, most provinces now tell women their breast density, which did not exist back, 8 years ago. The exception still is Newfoundland, who only tell them if they are in category D. There is continued advocacy to offer an annual mammogram to women in category D. Now, a few provinces actually offer this. So you can see that a few provinces, when you look at the third column, women in category D are offered annual mammograms. So there are a few provinces that do that now. Things have significantly improved. And these guidelines did not exist 8 years ago. Even Ontario just put this in place in July 2023, just to give you an example. Breast screening practices in Canada. So Dense Breast did a rating of the different provinces, and how they did the ranking is by asking 5 questions. Can women self-refer for a mammogram at age 40? Between ages of 40 and 49, is annual screening offered? Is the breast density category male to all women having a screening mammogram? Is an annual mammogram offered to women with category D density? And after age 74, can they self-refer? So the questions were those 5. And the ranking was that Nova Scotia and Yukon Territory are 5 out of 5. PEI is 4 out of 5. Saskatchewan, Northwestern Territories, and BC are 3 out of 5. Alberta, Manitoba, Newfoundland, and Ontario are 2 out of 5, and New Brunswick and Quebec are 1 out of 5. So there's still a lot of improvement to be had here in terms of breast screening practices.
Franz, we have a question from Rebecca
Yes.
that I'll just read out here. So Rebecca's question is, if you have not yet had a mammogram under the recommended age, how do you know your breast density?
you won't know your breast density until you have a mammogram. So if you can ask your doctor if they'll allow you to go and get a baseline mammogram that can be used for comparison years later. If there's any risk in your family, if other people have had cancer or breast cancer, you can be put in a higher category risk or category risk, and ask for a mammogram. We really need to advocate for ourselves as well.
Yeah, and especially also France had mentioned earlier, based on ethnicity, breast density is found to be higher, or women with more dense breasts are found. It's more common in Asian women, such as myself. I'm also a D, and then as well Black women too as well. So things like that might kind of give you some direction. But yes, unfortunately, until you have actually done a mammogram, you will not know for sure.
That is correct. So the point
Thank you for
is
the great
that,
question, Rebecca.
yes, it's a very good question. All right, so the next slide is that the point is that where you live should not matter when it comes to optimal breast screening. That's why advocacy is important and ongoing. And I would really encourage you to follow Dense Breast Canada on Instagram and Facebook. They have news updates all the time. It's incredible what they're doing. Okay, treatments. So this is just a one slide show. Advances in treatments. Essentially, I didn't want to get into a lot of information here because there is an incredible amount of information out there. But advances in genetic testing, immunotherapy, and other areas are transforming the way breast cancer is treated. So survival rates for breast cancer have improved in recent decades due to numerous new technologies and treatment advances. First is the 3D mammography, which is now coming on board. There's tumor profiling, which means that doctors can look for certain genes within the tumor to help select the most appropriate treatment path. Immunotherapy, which is using the body's own immune system to recognize and kill tumors. It has shown great promise in recent years for several types of cancers. And then new treatments for metastatic breast cancer. In 2016, this was data from a few years ago, but some 4,000 women were expected to die from metastatic breast cancer, which is the most advanced stage of the disease, stage 4, when cancer cells spread to other organs of the body. While there is no cure for metastatic breast cancer, there have been recent breakthroughs in treatments that help control the cancer and improve quality of life and give them a little bit longer life expectancy. So I believe now Jennifer's going to talk about some of the trends.
Yeah, so just in summary, just to kind of put it all together. So what this means for you in terms of your business and in terms of your clients, based on the statistics in Canada, we are seeing more younger women who are getting breast cancer. A lot more based on current medical trends and surgeries. We are seeing a lot more breast conserving options available for women. As a result of the breast conserving surgeries, this could lead to more uneven surgeries, leaving tissue for potential reconstruction afterwards. We are also seeing a lot more women opt for bilateral as well flat surgeries. The most famous one being Angelina Jolie. She had a family history, and so she just decided to opt for bilateral surgery. And as well, based on trends that we're seeing from custom breast prostheses that are being made in the US and in Canada, a lot of the shapes of the prostheses that are being made are showing the need for wider breast prostheses. So women, based on their physiology, just are having wider chests. And this could be related to obesity, but we don't have sort of firm data on that. So what does this mean for you? So as we're seeing, this could potentially translate into your business as women needing more fuller prostheses, as women are being diagnosed at a younger age. This could involve more fittings where a shaper is required. A shaper is just very, it's a much thinner prosthesis, so it could be used for rebalancing the two breasts. More fittings as a result of breast conservation surgery could require something with more of a malleable back. Such as on the left bottom hem corner there, you can see a prosthesis there where the back is malleable so that it could conform to the chest wall and minimize any shifting or discomfort there. There might be a higher need for flat compression bras, such as the 519, for women who are opting for flat surgeries. And then as well, a need for wider breast prostheses. Within American Breast Care's product line, a little trick is anything in the fourth digit. The higher the number, the wider the prosthesis. So in that image there, you see the 10287. So that's an 8. 8 is wider than 7. The narrowest prosthesis starts at a 4, and it goes all the way up to a 9. So that's a little trick for future if you do come across any clients who do need a wider footprint. Another thing we wanted to discuss is the coverage for breast prostheses as well as mastectomy bras across Canada. As you can see based on this chart, there's a huge disparity. There are certain provinces such as those that you see on the right-hand corner, which have no coverage. And then provinces such as Quebec, which have, which are really leading Canada, with over $500 of coverage for a full prosthesis and $300 for a partial. So this is very alarming. Many of the reimbursements by the province have not changed in decades. So this is something that really needs to be addressed, and we need to work together to find a way to improve on this situation. So advocacy is really necessary to help initiate or increase coverage in, whether it be Ontario, Nova Scotia, New Brunswick, Saskatchewan, PEI, Nunavut, Northwest Territories, and the Yukon. The goal here really is to have non-discriminatory coverage for women. Many women cannot afford to buy a prosthesis unless they have private insurance. So they really have to go without or wear less than ideal products. A breast prosthesis and a mastectomy bra, these are medical products. They're medical devices. They're regulated by Canada and recognized as medical devices, and they are necessary to facilitate women's physical and mental health after breast surgery. Questions for us would be, how to get involved in supporting increased coverage. Here are some tips, whether it be to draft letters and share the letters and ask for signatures. Ask others to share and start sort of a petition, whether it be survivor groups, everyone you know, and then write to your local MPP and bring awareness to this issue, and to really ask anyone that you might know, whether it be at the provincial government level, and to discuss this with your clients too as well, to see it really is a collective, and the numbers do matter. So we really need to work together to help promote and bring awareness to these huge discrepancies. And as a result, this is, we have so many advances on the treatment side and the screening side, but yet in terms of providing women medical products after their surgeries and after the treatment, this is an area that really has been neglected in certain provinces. So it's an area that we really need to bring awareness to. So I'll leave it. I'll open this discussion up to the group. Do you have any thoughts and ideas on how to go about accomplishing this in these respective provinces where the coverage is really just whether non-existent or just very inadequate? Okay, well, this is something that we thought we would just bring up and to kind of plant the seed in terms of having this conversation and supporting the community. But feel free to reach out to us after the presentation if you have any thoughts or ideas or are interested in getting involved. Because I think as a group, the more numbers, the better, and the louder the voice that we can present to the provincial government will definitely help to highlight this cause. With that, we will open up to any Q&A questions that you all have. You've been a wonderful group, and we are so happy that you are here today to learn about all these new developments here in Canada specific. Hopefully it will help you and your clients do a better job in terms of your day-to-day, and arm you with some information that will help you to provide a better service to your clients. If you need anything, don't hesitate to reach out to us. Here is all our contact information. And we wish you all a wonderful, wonderful week.